Who let the dogs out? Who let the dogs out? Who let the dogs out? Who let the dogs?
It is time for Pet Files Ask the Vet, underwritten by the Millerton Veterinary Practice. Traditional small animal medicine and surgery, chiropractic, laser therapy, acupuncture, and Chinese herbal medicine. 518-789-3440, millertonvet.com. With us today, Dr. Carolyn Cannon, owner, chief veterinarian, Millerton Veterinary Practice. We are always grateful when she turns up, when she can, because she is a very busy woman. Hello, Dr. Cannon.
Good morning, Jill.
There you go. Well, we
Good
know
morning,
you're busy.
Marshall.
He is waving to you, which, of course, it being radio, it's very hard to see.
Okay. Good
All right.
translation.
Thank you. It's my job. Sedora in Newburgh. And then there's a dog. Well, we'll get to it when we get to it. What is up with white dogs having red tear stains? Do all dogs have that issue, but you only see it on white dogs' fur? It looks so unhealthy, is it?
It's not necessarily unhealthy. No, if it's just tear staining, it's not unhealthy. But the tears do look red on white fur because there's a red tinge to the tears. I believe it's porphyrins. It's a substance in the tears that makes that rust red color. It's not unhealthy. It isn't necessarily a normal thing. So there are ducts, little holes inside the eyelids. So there's one on the inside of the upper eyelid, right near your nose, and then there's a little puncta, a little tiny one on the lower eyelid, close to the nose. So they're both on the inside, okay? And they are supposed to allow the tears to gain entrance to the nasolacrimal duct, which is a tiny little duct that goes into the nose. And so extra tears that are produced would go down in the nose and be swallowed, sometimes come out the nose. So what you're seeing is really either excessive tearing, so you're getting some tearing spillage onto the cheeks, onto the eye, the hair under the eyes, or you're getting some blockage of the tear ducts. Sometimes they just don't work that well, depending on how the faces are formed. So we have manipulated the genes in these dogs to make them little and cute, with little round heads and bug eyes, the way we've wanted them to. And unfortunately, the tear drainage doesn't work so well when that happens. So if you've got a white dog, now if you've got really excessive tearing, it could be that the ducts are clogged, and you might be able to get them flushed. Not so easy to do, but if your dog's going under anesthesia for spay or something like that, you ask your veterinarian to flush those ducts and see if we can get them working a little bit better. But typically, that little bit of red staining that you see is normal, quote unquote.
Oh, all right. So is it true that the buggier the eye, the more likely the... Really.
In general, but no, I've seen some little white dogs who have not protruding eyes that still tear a lot.
Yeah.
And if it's bilaterally symmetrical and it's just a little bit, then, washing it every day is what you'll need to do. You can try to flush them. I haven't had a lot of success with flushing and having it reduce the tear staining.
And what do you just use water?
I use an ophthalmolic. That's not easy to say.
Ophthalmolic?
An ophthalmic solution, typically, to flush, and a tiny, tiny, tiny catheter. So I have these metal instruments that will flush tear ducts, but I find that it's easier to use a tiny intravenous catheter.
Okay, so you're a veterinarian. I'm talking about...
you don't want to be poking around your dog's eyes with anything.
Nor knowing you, do you want to be cutting your dog's fur because you are scissors phobic. But what I want to know is if you are home with your blind spaniel, for example, and you notice that she has tear stains, for example, that are reddish tinged, for example, are you able to, or in Sedora's case, she obviously knows someone, is there some way to get it off, the fur?
Just water, warm water, okay. If you clean it every day.
All right.
You don't want to scrub too hard or you'll make the skin sore there, but at times, there's so much tearing that it already causes a bit of a dermatitis because the eyes are wet all the time. The face is wet all the time. And in that case, you should seek advice from your veterinarian to see if it's worthwhile to do sedation and a flushing, or just potentially apply a little bit of a petroleum jelly-like substance that's okay for the eyes on top of the fur, which will protect the skin.
Okay. I have a flushing question. This is a feline flushing question.
Mm-hmm.
The latest occupant tends to get into things, and he gets slightly gooey eyes, but he loves having his eyes flushed, and it really seems to work very well. Is that okay? I mean, how frequently?
So you mean rinsed?
Yes.
Rinsed, yeah. If you have an eye rinse.
No, it's the Vetricin. It's terrific, and
Vetricin, yeah.
And a couple of drops, and just bingo, and it's nice and clear, and it's not gooey anymore. So, I just wanted to know if there's overuse, but
no. If you're using it, if you're having to use it every day for more than a week or 10 days, or your pet gets buildup, then there may be something more going on than just irritant from
sticking his face in places where nothing has been for years.
Right. So lots of dust and mold spores. Right. Yeah.
So
that makes sense.
And I just found that it was that it worked, and once he became accustomed to it, I initially, when he came, he had some other stuff going on, but so I happen to know the difference between it. But I just after it was, he'd come out from stuff with the weirdest I don't want to say that my house is dirty or anything, but the weirdest stuff on his face, and then shortly thereafter, you could see his eyes were a little. A little goopy. So I started using this, and it's just worked a charm. And I wanted to know if that was really
absolutely. It's a really nice eye rinse, and has some antibacterial. It's not an antibiotic. Has some antibacterial effect in case you have an opportunistic conjunctivitis, because the conjunctiva is so irritated by those local irritants.
Right. Is there a human equivalent?
I don't know.
Okay. Just wondering.
Can't do that on the radio.
No,
I don't. I really don't know.
I understand. I've just many years ago with my first dog, which is a long time ago, doesn't even bear scrutiny. There was a product called Dacryus.
Mm-hmm.
And it came in a bottle, and it was just a wash, and it had the most perfect tip to it, so that you could go squirt. Right, it was a human product, but it worked brilliantly. And some vet said, yes, use it on your dog if you need a wash. Mm-hmm. And then as time went by, it disappeared, and it was replaced by all sorts of contact lens solutions and whatnot. And I've never found anything as good for both. So that's more where the question came out of. Not trying to get you to diagnose humans. Just it was just a wonderful thing. So I'm sure because it was wonderful, it's gone. All right, moving on to another cat with a situation that I'm not positive I can pronounce. It's Dave and Lulu in Poughkeepsie. Our vet diagnosed our cat, Mr. Softy, with, is it eosinophilic keratitis or eosinophilic or eosinophilic?
Sounds like eosinophilic.
Oh, all right,
eosinophilic keratitis.
All right.
Is what you're trying to say.
It is what I'm trying to say. Eosinophilic keratitis. His case is pretty far along because we got him as a rescue when he was already 7. The vet recommended she do surgery to remove the abnormal tissue from the cornea, but we did some research, and it looks like there's some debate around whether that kind of surgery is a good idea. Do you have an opinion, since we know you can pronounce it? No, I added that.
Eosinophils are a type of white blood cell. There are neutrophils, lymphocytes, and eosinophils. And in the cat, the eosinophil is sort of the cell of inflammation. But eosinophils in general can be in response to allergy or immune disease. And keratitis, meaning inflammation of the cornea, ouch, is something that we see happens, and it is sometimes in response to diseases that the cat cats might get when they're babies, like a herpes virus. Other times we don't know what causes it, but it seems to be, it's definitely an inflammatory condition, but potentially an immune-mediated condition as well. And so, number one, I would, with a severe or advanced case of that, I would defer to a veterinary ophthalmologist because we don't have a history for this kitty, I'm assuming. And I think my understanding is that surgery or a keratectomy, which is removing the outer layers of the cornea, in certain instances can be indicated, but typically when you have an ongoing process like that and you don't know what caused it, it usually comes right back. So, number one, a general practitioner is usually not someone who does a keratectomy. Maybe you're dealing with a veterinary ophthalmologist already, but definitely they would be the people. They don't want to, nobody typically wants to do a procedure like that is not going to be helpful and that's going to be, that you're going to have to come back and revisit and not be happy about. So I would suggest, if this isn't an ophthalmologist, to visit one and to sort of have some time to understand what your kitty's going to respond to medically. If he or she is completely blind, maybe it would be indicated, but I'm going to defer that to an ophthalmologist for sure.
All right, and is it fairly easy to find? You go to a specialty practice? What's the latest?
So if you live in New York, if you live in Connecticut, there's a great practice in Upstate Veterinary Specialties in Latham, New York, has two wonderful veterinary ophthalmologists. And then Connecticut, in Wilton, Connecticut, there's a wonderful ophthalmologist. And I think there may be I'm pretty sure there's another one somewhere else in Connecticut, maybe even more than that. I'm an old-timer, so these are the two people that I've been referring to for several years, or the two practices. I will say that, that you have to travel a little bit, but it's typically very much worthwhile. Now, I have treated, easier cases of eosinophilic keratitis with topical medications and had some success. So I'm kind of assuming that this has already been tried. Sort of more information on this I could be more helpful if I had more information. But I think in general, with an advanced case of a 7-year-old cat who maybe has been treated and hasn't responded, ophthalmologist is the way to go.
Yeah, I would think so, because at least the way the question is phrased, says the vet recommended she do it, but I just, if the vet's recommending it and you did some research, then I don't see the word specialist in there, and that would be the really, that's one of the ways that veterinary medicine has evolved over the years, and there are certain specialties, and it's something
absolutely,
like that.
And it's so helpful, because there is so much information. There's a glut of information out there. It is impossible for a medical doctor and for a person doctor and a veterinarian to keep up on the latest of absolutely everything. Besides the fact that the specialists are highly trained in that area, so if it's possible to do, that's my recommendation.
Okay, and all right, Chan in New York City. This spring I got a dog for my kids. Back in the days when we used to ride the subway, I always saw ads for Farmer's Dog pet food. So I looked into it, and it's a lot pricier than regular dog chow. Is it worth the money, though?
In my opinion, if you don't want to, it is a fresh, wholesome food. There's Farmer's Dog and My Ollie are the two that I'm aware of that will create based on your dog's breed and age, will create a diet for your dog. Now, the caveat here is that I believe My Ollie uses a veterinary nutritionist, and I'm not positive that Farmer's Dog does. So either way, I would call them, look on the website, give a call, and see if they're actually using a veterinary nutritionist. Last time I looked, Farmer's Dog said, I think that they're using nutritionists and then veterinarian approved, so it's not the same thing. You really need to have someone who's board certified in veterinary nutrition. It's very complicated. to make sure that your dog is getting everything that they need. It's a complete and balanced diet. Otherwise, you will be looking potentially at some problems later on. But the nice thing is that you can get really fresh food without any junk in it, without any, words that you can't pronounce on the label.
Right.
And who wouldn't want to do that if you can afford to?
All right, so I'm just looking at, since we're here, I'm looking at the website for Farmer's Dog, and I think this type of question has come up before because I was asking you about adverts, and it happened to be Farmer's Dog. It says a vet-designed plan is customized to your dog's individual needs.
Yeah, so if it was just a run-of-the-mill vet who's not trained in nutrition, that doesn't count in my book. This is really important. If you're going to be feeding your dog this every day, that you don't end up with a dog who's low in zinc or doesn't have enough iodine, that kind of thing, and then you can run into some really chronic problems with that. At least, the dog foods, the commercial dog foods are controlled, are AFSCO controlled. I don't know whether that's the case with these foods. I think I probably should educate myself, but I think that if they are, what I can tell you is if they are formulated by a veterinary nutritionist, so a veterinarian who is board certified in veterinary nutrition,
is what you're looking for.
Is what you're looking for, and
you have to ask the right question. That's
what I would ask.
Right, and I'm just going to cut to the chase here, just to say. Get the answer to that question, because otherwise it's very articulately worded, let's just say, but I'm with half an eye, I'm looking through it.
Yeah, why wouldn't they say that specifically? That's what my concern is.
Right, and that should be just flat out there, because again, I'm still recovering, and as I frequently say, and I'm old, from a cat cookbook that I was given for one holiday, one Christmas, I think, that if those recipes were followed, I'd have a dead cat. I mean, there's just no question.
Right.
And it looked nice. It's like, and the pictures were great, but it was if you don't have a lick of common sense, you're
right. And just because something has blueberries or chia seed in it doesn't mean that it's complete and balanced. It means that people know how to market to humans, and we have to be careful about that.
All right. Sonia in Millbrook. My husband and I have an 8-year-old. Is it Corso?
Cane Corso.
Cane Corso. Huh.
Well, that's how I've heard it pronounced.
Is it Italian? I don't know. I've got to investigate if it's okay. Well, we're going to call it Cane Corso, but I'm going to say Cane Corso.
You're probably right.
But named Billy. So I wish they hadn't put that there. I got distracted. All right. My husband and I have an 8-year-old something named Billy. For the past few weeks, Billy's nose seems to have gotten a kind of dry and crusty texture. My husband thinks it's because the heater's on in our house all the time, but I don't remember this happening last fall. Could Billy's nose have a problem?
Billy's nose could have a problem. There's something called hyperkeratosis on the nose of dogs and sometimes on their foot pads as well. And it is a skin disease that causes excess keratin, which is protein in the skin that's laid down on the nose, and sometimes on the foot pads as well. Hyperkeratosis can be a disease process in certain breeds. More commonly, I see it in dogs as they get older. Occasionally, as they get older, it's a condition that is poorly understood. We don't really know why in most dogs, but it can be associated with a zinc deficiency. So if your dog's not on you should see your veterinarian about it, number one, because you need to have some blood work done. So we want to make sure, especially if there's some going on in the pads, that there isn't any liver disease happening, or that it looks more like an autoimmune disease. German Shepherds are more prone to pemphigus, an autoimmune disease that might cause something to look like hyperkeratosis on the nose. But that being said, lots of older dogs come in, sometimes even younger dogs, and they have so much accumulation of this black keratin on the nose, and it cracks and it bleeds, and it's really uncomfortable. So it's something to see the vet about, and then sometimes it's as easy as applying something topically There are a couple of products. One's called Carasolve, which kind of helps to dissolve the keratin and soften up the nose. There's another one called Dermacent, which I like because it's a soybean-based, and it's pretty natural, all natural. You can put it on. Dogs, the tongue is going to come out and lick at it. So you want to put something on that's not toxic, clearly. Like you do not want to use Vaseline. But
petroleum jelly, boys and girls, petroleum jelly.
Right. Has an essential oil in it and some soybean oil that's safe. It really helps to moisturize the nose and soften it up a bit and keep it from cracking. Same thing with the foot pads. But if you're seeing this nose and foot pads, for sure, see your vet either way. I think it's definitely worthwhile mentioning to the vet when you go.
And I was good mind reading. I was just thinking that, I mean, is it something that you would just mention first before attempting to treat it, or would you?
With a cane Corso, I think I would probably see the veterinarian because they're a breed. They're really cool dogs. They are have a little bit of different genetics, and so it's possible that I don't see very many of them, so I don't know too many things specifically about their genetics, but it is possible that they could also be more prone to immune disease. So something to check out, and just have a veterinarian look at that. I can pretty much tell if there are lesions that are surrounding the nose that are problematic, that it's more likely immune, but you're not going to be able to tell from pictures.
Right. Yeah, the eyes, actual eyes are a really good thing. Actual eyes on the animal, even in this telemedicine time, is actually not a bad thing. All right, we have limited time. I hope there's enough to get through this question. It's from Maeve in Great Barrington. I'm getting a King Charles Cavalier puppy. She's coming from the breeders tomorrow. The vaccination schedule our vet laid out struck me as total system overload. She's only 12 weeks old. She's already had 3 vaccinations, and according to my vet, she'll need another at 17 weeks. As a mother, I've advocated for my own children to be put on a vaccination schedule that gives their systems a break in between shots. But I have to say my vet's being a lot more pushy than my pediatrician. Can you talk to me about how to advocate for my pup?
I can talk to you about how to advocate for your pup, but I also have to say that you have to have an understanding of the way vaccination works and the potential interference with vaccines by maternal antibody. So what I see a lot of times, I prefer to vaccinate at 8, 12, and 16 weeks for your core vaccines. And that's the distemper parvo combination and rabies, to fit the rabies in there somewhere. On smaller dogs, I tend to spread them out more as far as the rabies, not giving the rabies on the same day as the distemper parvo vaccine. But you need that final vaccine over the age of 16 weeks in order to make it effective and last for a year. Now, so advocating for your dog would be to really talk to your veterinarian about making a vaccine schedule that is specific for your dog and for what you want and for what you're willing to do. So many people object to having to come back frequently, and in which case they want to double up on those vaccines. But if you'd like to spread them out a little bit more, I would guess that your veterinarian, as long as you get things done in a timely manner to be protective, I would guess that your vet would work with you on that. So, for instance, in the state of New York, rabies vaccine is required between the ages of 12 and 16 weeks by law. And that distemper parvo combination vaccine, again, should be given at 8, 12, and 16, but oftentimes the breeder will give it at 5 or 6 weeks, or they'll give it at 7 weeks, and then they put you off schedule. So if they give it at 6 weeks, we'll do 6, 9, 12, and 16. So you see how it has to be somewhat individualized.
But it
Then-
also, I'm going to interrupt because we're out of time, but it also looks as though in this instance, this one instance, they've done 8-12 and they're giving 17. So it's actually, you're in good shape. You didn't need to advocate this is what you need to do.
Well, yes, unless they're asking you to do influenza, Lyme, lepto,
Right.
bordetella, and everything all on the same day. That's not something I would recommend.
Okay. Thank you very much, Dr. Cannon. This has
Thank you.
been Pet Files Ask the Vet, underwritten by the Millerton Veterinary Practice, 518-789-3440, millertonvet.com.